Good afternoon. Welcome to IPLAN Basics. This is the first in our IPLAN training webinar series, and we're excited to get this kicked off. My name's Laurie Call. I'm the director of the Center for Community Capacity Development at the Illinois Public Health Institute, and I'm joined today by my colleague Samantha Lasky, who is a program manager within the center, and we have several peer presenters today. Today live, we'll have Molly Peters, the administrator of the Greene County Health Department, Rachel Hendrickson, the public health strategist at the Boone County Health Department, Aldera Henderson, systems quality manager at St. Clair County Health Department, and by video, we'll have Amy Fox, the administrator of the Tazewell County Health Department. So join me all in thanking them for being here and being part of this training. And so you can just give them a round of applause in the chat or thumbs up or however you want to do that. But we are thrilled to have them. We're going to do a quick round of introductions with the Zoom polls right now. We don't have time to meet all of you. I wish we did, but right now we'll open up 2 poll questions. What's your experience with IPLAN? Basically, how long have you been working with IPLAN? And you'll select the best selection based on those options. And then our second question is going to be about your affiliation. And Samantha, I'm not seeing the Zoom polls. Oh, there we go. You can just go ahead and click your best responses there. How are we doing on response rates?
About 77% of folks have responded.
Okay, let's go ahead and close those and see what our responses are. Oh, we've got quite a few new folks. Oh, that just went away. Got quite a few new folks, so that's really exciting. People here less than a year, about 26%, 22% who have been here a year or two, and then shortly following that, we've got a few who have been here in between 3 and 10 years. And it looks like 10% for both 10 to 20 years and over 20 years. Great spread. And how about for our second question here, which is most of you are, as we thought, from a local health department, 94%. We've got a few other government folks and a couple others. What did people write in the chat if they selected other? Anybody write in the chat for other?
We have somebody from the Illinois Critical Access Hospital Network.
Oh, great. Great. Welcome. Thank you all. Wonderful to have some of our partners with us. So welcome, everyone. We're going to do a quick grounding and history and context for IPLAN. And one of the folks I didn't introduce is Joanne Bardwell. She'll be here from IDPH as the IPLAN administrator. Then we're going to go dive right into the Section 600 requirements of the Illinois Administrative Code for local health departments. And we'll look at the community health assessment and the community health improvement plan. We'll briefly cover the organizational capacity assessment. Then we'll share some IPLAN resources and close up for the day. So our purpose really here today is just to ensure that you understand the substantial compliance components of IPLAN. You understand where IPLAN came from, what IPLAN is about. You understand the relationship between Public Health Accreditation and IPLAN, so we'll briefly discuss that. We hope that through going through all of the sections that we'll go through and talk about how you approach and how you do some of these things, that you'll be able to think about the amount of time and the resources it will take to do some of these activities and prevent some common mistakes that folks sometimes make in putting together their IPLAN and submitting that. And finally, we want to make sure that you leave here today knowing how and where to get more information, because we'll just be scratching the surface today, but we hope that you will lean on the resources and us for more information. We for all of our trainings, we have group agreements, and we're asking that today you actively participate. We would love to see you on video. And we'll have a couple chats, a couple Zoom polls. And so those things will all require you to participate. So you'll get more out of it if you do that. Um, we're hoping that you'll be open to maybe some new ideas that our partners will be sharing. And we have a really, really tight timeline. So we're going to need to just keep things moving and move along. It might seem a little bit fast, but we're trying to get as much information to you in this short amount of time as possible. If you do have questions, you can put them in the chat. We might not be able to get to them today. We might have to follow up with you. If there's something that's really confusing and you really need to interrupt and say, wait, I didn't get that, feel free to raise a hand, and Samantha or Madiha will interrupt or pause us to make sure we can answer that question. But we definitely will try to park some of the questions and get back to you. If there's anything else that you feel like you need to make today successful, please put it in the chat and we'll do our best to take care of you. So I'm going to now introduce Joanne to you, Joanne Bardwell. If you have not met her, the IPLAN administrator. Joanne will just start us off with a little grounding on the history and context of IPLAN, and then I'll pick it back up from Joanne. So go ahead, Joanne.
Well, thank you so much, Lori. All right. Good afternoon. Thank you all so much for joining us for our first IPLAN training webinar series. This is brought to you with our grant funding for the Community Health Needs Assessment. So I have been the IPLAN administrator now going a little bit over 2 years. So I appreciate everyone for all the learning activities that we have in advance. And as already stated, if you have any questions or anything, put them in the chat. The definition of IPLAN, because I know a lot of people hear that quite often. It stands for Illinois Project for Local Assessment of Needs. It is a community health needs assessment and planning process that is conducted every 5 years by the local health department's jurisdictions in Illinois. It's based on the assessment protocol for excellence and public health, which is the APEX model. Completion of the IPLAN fulfills most of the requirements for the local health department certification under the administrative code of the 600.400 certified local health department. And so you will have these resources and access to be able to go back and reference to the administrative code here in upcoming slides forthcoming. However, the essential elements of the IPLAN is the organizational capacity assessment, a community health needs assessment, and a community health plan, which is focusing on a minimum of 3 top health priorities determined by your local health departments. So on this one, as we made reference to being able to access the Illinois Administration Code at 600, the full administrative code is at this hyperlink. So once again, you all will be able to access these slides or this presentation here shortly and be able to go back and reference. And I highly suggest to save this as a favorite to your desktop, and or also even reference your certification and previous certification applications that go reference specific administrative codes. All right, so what does the certification requirements look like? So local health departments develop the IPLAN. Some of you all partner or collaborate with the hospitals, which is every 3 years. However, the IPLAN process itself for ours is every 5 years. Then you submit the local health department submits their IPLAN to our IPLAN corresponding mailbox, a dph.iplan@illinois.gov, at least 60 days before your current expiration date. A lot of people tend to not realize what that is. So if you're not familiar with that, go back to your current certification or certificate that reference your expiration dates. The month and the days never change, just the years. And so with that, you'll the local health department will supply the certification application. Some of you are not ready to submit it at the 5-year mark, and that's okay because we have extension requests as an option for you all. You and see here at the note, just send on the letterhead a formal notice, the date, the reason for your request, and make sure it's signed off by the administrator and send that to the IPLAN or corresponding mailbox. However, and that's due no matter what for the first 60 days alongside with your certification application. And that's basically making sure that we are contacting and communicating with the current IPLAN teams because we keep track of the administrators on the local health department directories. But this gives us an idea where you're at in the process. Have you been able to start it? Are you aware of the administrative code requirements and everything that is listed in the certification application? And all you would have to, and do you have the current personnel? Do you meet the requirements for that? If not, you just give us those justifications and everything, and we'll be able to reach back out to you and be in communication further. With that, if once you are ready, you submit an electronic copy of the IPLAN, which consists of your community health needs assessment and community health improvement plan. In reference to the organizational capacity assessment or strategic plan, if you choose to go that route, we just need you to sign a letter from or have the Board of Health sign a letter saying that this has been conducted and it being dated. We do not review the IPLANs until the IPLAN is submitted alongside with the IPLAN substantial compliance evaluation form, which is a full transparency form of what exactly we're looking for compliance with the administrative code rubrics. And the local health department, you will put your page numbers alongside with table of contents. So once we get these items, we have 60 days to review and go back. If it's not in compliance, the local health department is provided findings and are required to resubmit and update an IPLAN to the IPLAN corresponding mailbox. And if it is in compliance, you're sent a notice, you and the RHO notified of approval of IPLAN, and then the director's office is also notified of findings for final approval. And after the local health department and RHO are notified, typically I kind of condensed this really into like one day because we used to do the certification application on site revisit with the RHOs in the back end. However, we do that in the front end. So right now I do them both. The certification application the certification letter, and certificate alongside with the IPLAN approval are submitted to the local health departments to confirm that you are awarded 5-year recertification. And everything is via electric. So here is the certification requirements. We received a certification application from the local health departments, and then the IPLAN is submitted by the local health department, whether it's your IPLAN team or committee and or the administrator. The IPLAN must include a table of contents with page numbers, the Board of Health approval letter of the IPLAN signed by your Board of Health president or representative, which includes, like I stated before, it's saying that they've reviewed your organizational self-assessment plan and that they approved your IPLAN. No need to submit the organizational self-assessment plan. Keep on file for the regional health officers to review, because at any given time we can conduct a request that you submit those documents. And this is, like I said, just an overview of what I've already basically shared with you all. And so if you have any questions, please reach out to me or send to the IPLAN corresponding mailbox of the dph.iplan@illinois.gov. Another thing to note, though, is if there's any applicable name changes or changes that need to occur to the local health department directory, please send a formal notice on your local health department letterhead, signed, dated, and addressed to the IPLAN administrator at the dph.iplan@illinois.gov.
Thanks so much, Joanne.
All right, thank you.
Just want to talk a little bit about the evolution of IPLAN. So as Joanne mentioned, the IPLAN process was developed in Illinois based on the Apex PH model, which was developed all the way back in 1991 which I'm sure there are some of you even who maybe weren't even born yet in 91 who are on this call. So it's a really old model, but it does have the basic foundational components of a community health assessment and a community health improvement plan. The challenge is that that model no longer has archived documents online or accessible documents online. So we really have what we have in Illinois in the IPLAN process and the tools that we'll be sharing here today. So IPLAN started in 1992 in Illinois. Illinois was really a very progressive state at that time in requiring all of their local health departments to do a community health assessment and community health improvement plan every 5 years. And after that process was going for several years, NACCHO, who had developed, NACCHO is the National Association of City and County Health Officials, of which many of your organizations are members. After they had developed Apex PH, the field really wanted a more robust model, and they developed MAPP, Mobilizing Action Through Planning and Partnerships. And that MAPP model was just updated in 2023 for a new iteration. But because of that, the certification code had to open up and make an opportunity for local health departments to be able to use the IPLAN process or to use an equivalent planning process such as MAPP. So that was in addition to the requirements for IPLAN. Not long after that, the Public Health Accreditation Board, or PHAB, was formed and developed, and they had a requirement also for community health assessment and a community health improvement plan. And so many health departments were pursuing accreditation. And so again, people who were pursuing PHAB accreditation and received PHAB accreditation, they had similar, maybe more stringent requirements for IPLAN. And then the Affordable Care Act was passed, and that required nonprofit hospitals to do a community health needs assessment. So communities who weren't already working with their hospitals and healthcare systems may have started working with them because they had to do a very similar process. So that has brought us to the point today where many health departments do collaborate with their healthcare systems and hospitals to do their community health needs assessment. They may be using the MAPP model, they may be using the IPLAN model, they may be following the PHAB accreditation standards and measures, and I'll share those with you today. But all of those are in alignment with the minimum expectations for IPLAN. Oops. So this is just a bit about the equivalent planning process, and I won't spend time on this. I'll just leave it in here for your reference. And now I'd like to introduce and turn it over to Samantha Lasky. Samantha's going to introduce our next section.
Thank you, Lori. Hello, everyone. So for this webinar, we'll only focus on the Section 600 requirements for IPLAN, which was developed based off of Apex PH. Next slide. So the goals of Apex PH are to assess and improve the organizational capacity of the health department and work with the local community to assess and improve the health status of the citizens. Next slide. We'll review the first two components of the IPLAN out of the three in detail today, the community health assessment and the community health improvement plan. And we'll briefly describe the requirements for the organizational capacity assessment. But first, we'd like you to share some information from your peers on why the IPLAN is important to them beyond the certification requirement. So next slide. And we have a video here to share with you from local health department staff. Go ahead and just hit the button. There we go.
For Peoria County, we are a very diverse community, and we recognize that our populations have various health needs, as well as different access to those social determinants of health. And so for us to do this assessment is a way for us as the chief health officers and the strategists of our communities to really be able to take the time and the effort to focus on identifying, surveying, getting feedback from our community of what their health priorities and needs are so that we can better address them.
It is what we invest in for the community for over 5 years or for a period of time, and drive down our community needs and reshare why we are doing active work at the health department. And then we make improvements based on grant funding that we focus in on the IPLAN.
So for our county and really kind of our region, we utilize the IPLAN data not just as a report or a compliance piece to turn in, but it's how we determine where we're going to provide programming. It tells us where our priority populations are. It really drives the additional work that we can do as far as where we're going to look for grants and how we're going to describe problems in our community. Recently, a success of that was we were available to kind of meet, honestly, a funding stream we never thought we would. It's an energy transition grant that was coming from the closing down of coal-fired energy plants, and we were able to get dollars for mental health needs in our community because we had that IPLAN data. We had a strong case for it. We're able to describe our gaps and show that the area that they wanted us to impact was the area that we needed to work in. So we're starting to see additional dollars come into our department because of the work of the
The process helps us understand what is going on with the health of the community. We're incorporating everybody. We're incorporating employees of the health department. We're incorporating our community partners and our community itself, and focusing on what is everyone's perspective, what are they identifying as top priorities, and it's providing a collaborative opportunity for everybody to work together to identify that. So everyone is an equal partner in all of this, in explaining it. And it serves as the foundation of everything that our health department is involved with planning grants, with working within work groups and organizations. It serves as the foundation.
The IPLAN is important for the Boone County Health Department because it's our North Star for community health improvement planning. We really use it to do a community-based strategic planning process, right? And we've been really focusing on that community-driven aspect by incorporating the public's feedback at every step of the way, because that's the point of IPLAN, right? Is to serve the community in the way that they need and want to be served in public health. So I believe that's important for every local health department to use, not just to check the boxes, but actually do the assessments, get meaningful data, get feedback from our populations of interest based on the findings to make sure that we captured their stories correctly, and then actually get to work on.
It allows for uplifting of the voices of our community so that they can truly be heard. We engage our residents by coming together. They look at data, and it helps them to prioritize through a consensus process the needs of our own community here in which they live. Really, by uplifting the partner voice, a true vision is created that is unique to our own county, and it ensures that we are improving health for all people in all of our communities.
That was great. Thank you. We appreciate everyone who contributed, and I hope you enjoyed hearing from your peers. We're going to jump into the community health assessment components now and just define that. So the community health assessment is a systematic approach to collecting, analyzing, and using data to educate and mobilize communities. You heard that a lot in the last piece. Develop priorities, garner resources, as Amy shared from Tazewell, and plan actions to improve the public's health. We have a few other definitions that are going to come up in this section. So the first one is health problem. You heard that Joanne said we have to choose 3 health problems, health priorities. It's a situation or condition of people which is considered undesirable, is likely to exist in the future, and is measurable, such as death, disease, or disability. And the second definition we want to look at here, which is what we're really striving for, improving is health equity, that everyone has a fair and just opportunity to be as healthy as possible. This can require removing obstacles to health, such as poverty, discrimination, and their consequences, including powerlessness and a lack of access to good jobs with fair pay, quality education and housing, safe environments, and healthcare. Many of those things you'll hear referred to as social determinants of health, and a lot of the data that we're looking at, data that we're collecting from the communities, really is about those social determinants. So it's not just how people are dying or what they're dying because of, what's the cause of death, what are their illnesses, but really how are people living and what's impacting how healthy they can be. So those are the things that some definitions we're gonna be using today. In the IPLAN process, there are 6 major steps or components in the community health assessment. First, the convening of the Community Health Committee, which is a requirement, analysis of health problems and health data, the prioritization of health problems that emerge from that data, looking at a detailed analysis of community health priorities, inventorying health resources, and developing a community plan, which is the next step. So on developing the Community Health Committee, you may call it something different. It doesn't matter what the name is, but what matters is that this is a way to bring community voice to the process, to be aware, to be engaged, to build strategic alliances, to partner in the work and of the assessment, but also the implementation. And it's really an initial opportunity and demonstration of the local health department's willingness to partner and engage and collaborate with community. So this has been a requirement since the beginning, and you will note in other assessment processes that this is also a requirement or something strongly encouraged. So as you're thinking about your community health committee, you want to think about the scope of that group, how large it will be, really defining what their roles and responsibilities are. If you need subcommittees and how those subcommittees will operate, because that can be really helpful in making a more efficient collaborative. And the representation. So we really want this to be a multi-sector community health committee. We want organizations to represent a variety of different sectors who contribute to the public's health, who deliver essential public health services. And we want them to be representative of all areas of the community and all types of community members. You can have actual community members on the committee. We want people who understand the challenges and the issues that people are dealing with, particularly those who are experiencing greater health inequities. When you have folks with a variety of different expertise in some of the areas, priority areas, that's really helpful. When you have people who represent diverse sectors of the community and population, like you see here, this is just a snippet of potential types of organizations. It's certainly not all. So let's use the chat here and identify what type of sectors do you have represented on an IPLAN committee. And if you call it a steering committee, if you call it a leadership group, whatever you may call it, what types of organizations do you have represented? We'll be
can read
sending
the
the slides
chat.
out with the link to the recording after the training.
We have steering committee and working groups, EMA, hospitals.
Okay. What about some maybe non-traditional partners? Who's maybe one of your most unique sectors represented beyond healthcare?
We're seeing hospitals, funders, NPOs, community members, behavioral health agencies, prison systems, park districts, chambers of commerce,
Faith-based.
recovery-oriented systems of care, occupational health.
Great. Great ideas. Thank you. Thanks for sharing that. So there is a requirement that you have community participation in the community health assessment, and they should be involved in as many places, as many areas as possible. They can be involved in identifying the community health problems. They can be involved in helping you understand the secondary data. So we'll talk about data in just a minute, but as you're pulling data and you're comparing that data, they can help explain experiences in the community, challenges, obstacles that really help explain why there are differences in that data. They can be involved in priority setting and really helping you to complete that overall community health needs assessment, and also involved in developing the community health plan. So just a couple tips as you're putting together your IPLAN. You will start off with a statement of purpose. Why are you doing this community health assessment? What's the purpose of it? And a description of how the community participated throughout the community health assessment. You'll be including that, as well as a list of the community groups who were involved in your IPLAN. Not just the list of the Community Health Committee, but if there are other community groups who have been involved in different places throughout the process, you'll want to make sure you describe that as well. So those are a couple tips on pulling together your IPLAN, and I think we're going to be hearing from some folks later in how they have engaged people in their IPLAN process for their CHIP. Okay, let's talk a little bit about data collection now. So we have identified our purpose. We have thought about how we're going to engage folks. We have a community health committee. Now we have to get down to action and really start pulling together all the data that's going to help us understand the community. We want to be able to have demographic data, social determinants data, all that data that's going to describe the community area. And we have both primary data, which is data that you collect or someone else collects firsthand. It might be through surveys, it might be through focus groups or listening sessions, interviews, direct observations. There's many different ways you can collect that. Or secondary data is data that is collected by another entity or for another purpose and analyzed in that way. So it's not the data that you're collecting for this specifically. Indicators are the secondary data that have been analyzed, and we use those to compare rates or trends across the priority community health outcomes and determinants. So that's the data that we traditionally think of when we think about a community health assessment. We're thinking about what's the data telling us about rates of disease or rates of illness or those types of things, morbidity and mortality. All of that type of data will be part of the secondary data. We want to make sure that we are analyzing all of that community data, and the IPLAN requirements say that we have 7 categories of data that are listed here on the screen. And we need to make sure that we have data in all 7 of these categories. So the IPLAN data system, or iQuery, which is the newest version or the latest version of the IPLAN data system, is available. Data is being updated regularly now in that iQuery system. Staff on Joanne's team are working very hard to get that data updated, get that data ready for you. If you have specific needs, you can contact them and we'll provide that contact information. If you have challenges with that, we're having a webinar coming up during one of our TA sessions that's specific to iQuery and some of the new data sets that have been uploaded. But at a minimum, you should be looking at the iQuery Illinois IPLAN data system to pull data in these categories, and where that data is maybe not as current, or there is more current and more locally accessible data for your jurisdiction, you can add that. You can add any additional data. It's just at a minimum, you should be looking at iQuery first, according to IDPH, and you should be collecting data in these 7 categories. When you're collecting data in these categories, you're going to be looking at a variety of things. First, when you're planning, you're really defining what is this community area, and you're describing that community area. So any of the demographic data that will help to describe that community area, you want to include in your IPLAN. You're also identifying priority populations, and those priority populations may come from your previous IPLAN. They may come from a look at your current data, but some of those populations that often experience greater inequities from different race ethnicities in your population, maybe from unhoused individuals, people experiencing mental health issues, LGBTQ community. So there's a variety of different subpopulations or communities that may be experiencing more inequities, and you'll want to identify and describe those priority populations when you're describing your community as well. You want to determine what secondary data do you need. You need at a minimum those 7 data categories, and you want to be able to use the smallest geographic locations possible that still protect the data. And you want to identify what primary data do we need to collect. So we often recommend looking at that secondary data first to help inform the primary data that you're going to collect. When you're collecting primary data and you're using tools like surveys or focus groups or interviews or town halls, you're really trying to reach the community and answer questions that you can't answer from that static data that is the secondary data. What do you need to know? What questions are you left with when you look at that data? It can be really helpful to build off of your last IPLAN and think about the questions that you may have asked or answered, what the data was telling you then, and if you need to check in on something to see where things are at related to that data, that can be helpful with your primary data collection. You're analyzing all of that data, you're comparing data when possible by some of those demographic characteristics, by age, gender, race, ethnicity, or other demographic characteristics that are particularly important in your population or your area. And you also compare that data to regional or state or US data. So how does your county or your city compare to the state, and how does that compare to nationally? So you want to see that as well. So we will highlight this webinar here that we want you to join. It's a follow-up session to this on iQuery and will be offered on October 10th. If you haven't registered for that already, you can join, register by the link that you joined this one, and that will be in the chat as well. So let's pause here for a Zoom poll. Got a couple questions here for this poll, and if you don't mind opening that up, Madiha. Does your local health department collect community input data for your IPLAN? This would be primary data collection. And what methods do you use? And you can select all that apply. If you select other, please write in the chat what other methods you use to collect primary data. The poll just disappeared. Did we close it? Great. The results, so 98% of you do and a couple unsure. It's fine. A lot of people doing surveys, 98%, 58% on focus groups, 23% town halls. We've got a few folks using photo voice, which is capturing photos to tell stories. And a few people wrote other. What did we get in the chat?
So we have a couple people who used ethnographic interviewing,
Great.
and another who used key informant interviews.
Awesome. All right. Appreciate that. Thanks for your participation there. These are some common data sources, and we're not going to go into detail on this list at all, but these are things to supplement the data that you pull from iQuery and download from iQuery to use. But this is just some of the data that we're familiar with that we've been using. There may be other data sources that you're using. So I would love it if you write in the chat if you have a particular data source that you really like that's not on this list, or even one that's on this list that you really like, add that in the chat. We'd love to compile more and add to this list. So any new data sites or data sites that aren't on this list that you like, please put that in the chat and we'll add it to our list for future trainings.
And somebody noted Spark Map.
Oh, yeah. No one. Anything else in the chat?
Yep. Cook County Health Atlas. Another person said we have a local housing authority data set. Another person said odmap.org.
Great.
I think that's all the responses.
Okay. Thank you. So we're going to hear now from Aldera on how they analyze community health data.
Hello, can everyone hear me?
Yeah.
Okay, so this is our process, and as you can see, I'm Aldara Henderson, and I'm from St. Clair County. We're across the river from St. Louis, so we're here across the river in the Metro East. Our process, we just recently completed our own community health needs assessment. So as we know, the hospital systems are on a 3-year plan. We're on a 5-year plan, and we decided that we were going to collaborate and create and work together to create an annual or biannual community health needs assessment and work on it together. So we have our 2 hospital systems and our other health department, our health district that's here in our county, and we're all working together on this. Next slide, please. So we initially start with our secondary data analysis. So for example, we had a 50-page PowerPoint presentation of just every demographic, every bit of information that we could find within our county. We also were lucky that we had some data sources that the hospital systems had access to that we didn't, that we were able to incorporate into our data dive. And for example, we look at trends over time, and this is Alice that we were using, is one of the data points that we used in our data dive. Next slide, please. So after our data dive, we came we found 14 of our top priorities that seemed to rise from the top through all our analysis. And so these were the 14 priorities that came together. Next slide, please. And then what we did with our healthcare commission, which is our commission, our committee, but it's any organization here in St. Clair County that touches health. So it could be mental, behavioral, anything. We have our prison systems involved with it also. And so we presented at our healthcare commission our priorities that we had come together with our data dive. And in this, we asked each of the agencies that were involved in our community in our healthcare commission to rank out of the 14, their top 5. And then within that top 5, to force rank those 5 priorities with the defined criteria. So we looked at triple impact, magnitude, seriousness, feasibility, ranking from lowest to highest. Next slide, please. So for example, this was our health department came up with, and what we ranked, what were our priorities. And this was resulting from taking these priorities and having our staff rank them, and then having management, division directors, and leadership coming together and taking into account our what our employees had identified through their clients. And these were our priorities. So each of the organizations involved with our healthcare commission did the same exact thing. Next slide, please. So then we took everybody's rankings and we came here with the rankings of the 14 that we identified. And we took the top 6. Next slide, please. And these were the 6 that we identified through our healthcare commission, so our partner agencies, through and within those agencies, with our employees, we had even the medical school with their medical residents also reply to this. So these were the 6 that we identified as our top priorities. We took these 6 and we had in our community survey, we had over 440 participants, and part of the survey was for them to force rank these top 6 into their top priorities from 1 to 6. Next slide. So our healthcare commission and our partner agencies identified these 3 priorities as our top priorities in St. Clair County, and then the residents identified these 3 priorities as the top priorities in St. Clair County. Next slide, please. And then what we did was we brought our results back to our healthcare commission and our partner agencies, and we had them taking into account our community and our own results, what we chose from our agencies, and had us once again prioritize and force rank the top 6 priorities. So as you can see, mental health, chronic disease, and behavioral health were the top 3 priorities here in the county. And so doing all of this, everyone has worked together, and now we have this. And as we track trends, because our IPLAN isn't due until 2026, so we made no changes to this, but we did present this to our Board of Health to identify in 2023, these were the top priorities. So through all of that, and it was extensive data analysis using iQuery, using county health rankings and CDC Wonder, and multiple other sources, and then doing our community survey and taking that into account, looking at specific zip codes of answers in our community health survey, and using that to help guide us. So that's it.
Thank you so much. That was really helpful. So when we look at this screen here, the description of health problems most meaningful to the community, you can hear that Aldera referenced some of these things as they were looking at the data. What are the trends showing? What changes have occurred over time? How do we compare to state or other level data? What are the differences between population groups? When you're comparing that primary and secondary data, and she's talking about the community survey that they did, what is that telling you about what's meaningful, what's important to the community? So they were considering that when they were looking at other data. How does the primary data compare to the secondary data? How does the data help understand what is contributing to the health problem? And then the next piece is, how do the emerging health problems and needs compare to the state health improvement plan or the SHIP? And we'll hear from Amy Fox at Tazewell County for how they do that. Not playing, Samantha. Do I need to hit it again?
Yep.
So Illinois has to do their own assessment and their own improvement plan called the SHIP. And so for Tazewell, one of the things that we have done, each of our go-arounds for our planning, is to take whatever SHIP is current for the state and overlay that and its objectives across what we're currently looking at in our community. And even though you may use different context or words, you can see if what you're talking about maybe overlays with that. So this is the last go around in 2023, and we took a look at what was listed. You can see some boxes we have the same thing marked and others were not. But at least it's showing that we have done a scan and we're commenting on, what the health priorities are of the state and how they relate to our county. We can also put some historical information in here so you can see in the state SHIP, they look at maternal and child health. And we also put some context there saying that while that's not a priority, we have been looking at it as far as performance management in areas such as STIs and outreach and preterm births. So we do not, while it's not a current health priority, it is still being considered within our community. So one of the things that we need to pay a lot of attention to is not only what's happening nationally, but state and locally, and seeing where alignment can take place across your priorities and the state's priorities and the national priorities, so that that's considered in your planning and in your moving forward for your community.
Thanks to Tazewell County for sharing that. It's a great visual on how to compare to the SHIP priorities. The 2023 State Health Assessment and State Health Improvement Plan produced the following priorities: racism as a public health crisis, chronic disease, COVID-19 and other emerging diseases, maternal and infant health, mental health and substance use disorder, with several cross-cutting issues that relate mostly to social and structural determinants of health. And you can see those in the center. We have provided a link to the Healthy Illinois 2028, both the SHAW and the SHIP, and you can take a look at that. And they have to do this based on a requirement in law, and have to do this every 5 years, just like all the local health departments. So we encourage you to take a look at that. In addition, on the IPLAN website, one of the things that I forgot to include in this training is a picture of what the current priorities are of local health departments. So IDPH has been monitoring what priorities local health departments select, and we have been compiling those along with them to share with you. So if you're interested in what other health departments have selected, we have those in a combined form and visual to see how many health departments have chosen what priorities. And that just might be of interest to you to see. So I'll turn it over to Molly now. Molly is going to share from Greene County how they describe health problems most meaningful to the community. Molly?
Yes. I think my slide is next.
Yeah.
Okay, perfect. So I'm Molly Peters. I'm with Greene County Health Department and Scott County as well. And, what we do is, I think is my favorite part of the IPLAN process, is to really talk to people individually through survey and really discuss and hear the voices of your community. We do this through some interviews. We ask people who usually have the highest social vulnerability. The stories is really what makes the IPLAN really have the information in there of what the actual impacts are. So the story is very, very important in conveying your message and why this should be a priority for the community, and all of the voices that are sharing within the community. So we use the IPLAN to ignite change in our community by searching for grants, for funding, and to encourage grassroots efforts that are making changes and we use the IPLAN to say, hey, look, what you're doing relates to what the community wants. It is what the community needs, and it goes back to the data that we receive. So, the epidemiologists also usually love the data components, and I'm a former health educator, so I really love the interview process and the discussion and the focus group processes that come along. So how do you get the voices of what is most meaningful? We ask questions and we listen to the community itself. When I first started as the administrator, I visited each school district and the superintendents there, the hospital directors, the doctors, community partners. We are a small rural community, so this is, actually 3 superintendents in our community, but, it helps get a picture of what each community is struggling with and what their needs are and what they want the future to look like and the opportunities that might be available for the health department or for healthcare in general that are not existent. So speaking with individuals is highly, highly important. So we generally conduct a survey. This might be in between the interview process. It might be for a duration of time, but we conduct a survey that kind of has a list of data points that we have received through just general data collection. And we actually did this during COVID when we had a 15-minute, wait period. So we'd hand people documents, paper documents. We'd have the QR code, and individuals would write down a list or specific data points that they wanted us to focus on for our IPLAN. Then following that, we really gathered people with boots on the ground for focus groups, and this included people in the healthcare setting, faith-based organizations, early childhood, business owners, city council members, behavioral health, hospitals in general, parents, and consumers. Also, involving our Board of Health in those focus groups is important too. They share and gain a picture of the day-to-day of what that people are impacted by, and in addition to that is focusing in on people with the highest needs and social vulnerability and hearing their voices. And as you do that, you get the picture of what is the most meaningful topic because you hear it said over and over again. And I think that's just most impactful to me, is to hear those voices and hear that it's a similar message of needs and concerns within the community.
Thank you so much, Molly. That was great. We appreciate your sharing. All right. The prioritization process, we heard how St. Clair County did that, and that's great sharing that example. I just want to highlight that this is a resource from NACCHO on various prioritization processes and criteria that may be used. So you can click this link and check out these resources. And one of them was the Hanlon method that is often commonly used. It is written up in the IPLAN workbook, which we'll also make sure you have a link to. The IPLAN workbook has not been updated in quite a while, but it still has valuable resources in it. And I encourage you to take a look at that on the iQuery resources site. So we won't spend time going over that Hanlon method just because we're a few minutes behind right here. I do want to mention a couple other definitions though, as we're going into this next part, and we really need to be able to describe the health problems that we have identified. A risk factor is a scientifically established factor or a determinant that relates directly to the level of a health problem. So a health problem might have a number of risk factors. Direct contributing factors, again, scientifically established factor that directly affects the level of a risk factor. And an indirect contributing factor is something community specific, a community specific factor that directly affects the level of the direct contributing factor. So these can vary community to community, and we'll show you what those look like in just a moment. This is one of the things that you'll be doing for each of those health problems that you end up selecting. If you select the minimum of 3 or you select more than 3, you're conducting a detailed analysis of those health problems. So you're really describing through data as much as possible what the risk factors are, what you're seeing, what those determinants of health and those contributing factors are. What is specific to your community area? Maybe it's the lack of grocery stores or the lack of physical activity space. Whatever it is that is unique to your specific community would be those indirect contributing factors. And you can use a tool if you'd like that's on the IPLAN website to describe and to think about those risk factors and those direct and indirect contributing factors. So it would look like this. This is a tool that If it's not on the IPLAN website, we'll make sure that you receive this, that it's available to you. And this helps you kind of think through what are those most common, most prevalent risk factors related to the health priority that you've selected. And then for that risk factor, what are those direct contributing factors? And for each direct contributing factor, what are the indirect contributing factors? And remember that last column, the indirect, are really community specific. So here's an example of one that is completed and filled out, and you can look at this at your leisure. I'll just keep moving along since we have a bit to get through yet and are running close on time. The other thing that you do is inventory community resources, because we don't want to just be deficit based. We do want to be asset based as well. We want to leverage those community resources. We want to inventory what are the things that are helping people to be healthy, that are available to leverage and build on, that really are resources. So maybe you do have farmers markets, you do have healthy food available. You have programs where you're able to do double value coupons. You have more parks or a new park opening up, more green space, more trails. What are those resources that are available that you can plan for as well? Asset mapping is something that you might want to do or engage in at this step, but it's inventorying and understanding what those factors are that can address the challenges and issues that you've identified. So I just wanted to share here that the public health accreditation requirements for a community health assessment are really inclusive of everything that the IPLAN process is. So this page will just show you that they're really lined up. It's very similar. You have to have community involvement. You know, you need to be able to list who's involved and how they're involved in the CHA. Same thing for IPLAN. You are looking at primary and secondary data. You're describing all the demographics of the community. You're describing the health challenges experienced by the community. It's really the same as the description and analysis of health problems. It's just different language, but it really means the same thing. And when you're describing all those risk factors and direct and indirect, this speaks a lot to the description of inequities and the factors that contribute to the health challenges, which include social determinants of health or the built environment, based on the examples that I was just giving about food deserts and proximity to parks and green space, and then the community assets and resources. So that's very, very similar to what you would be doing if you were meeting the public health accreditation requirements. So that's just a little nudge to you health departments who aren't pursuing public health accreditation to know that you're already one step forward in doing the IPLAN, because that's a minimum requirement that you do that. You also need to make sure that your community health assessment is available and accessible to the community and other organizations. So let's take a look now at the Community Health Improvement Plan, and that's the second component. The Community Health Improvement Plan is intended to be a long-term, in this case for IPLAN, a 5-year systematic plan to address issues identified in the community health assessment, describes how the local health department and other community partners will work together to improve the health of the population. So these are the components. Again, you will have a purpose statement for why you're doing a community health improvement plan. You'll describe the planning process and how the community was involved in this process. You'll have a description of each priority, and for each priority, you'll have a measurable outcome objective, impact objective, an intervention strategy for each objective, and you'll compare that to Healthy People 2030 or whatever Healthy People version is out at the time. And then, even though it's not required to submit an evaluation plan, you need to have a process to understand how you're going to monitor and measure what you're doing. These are also very similar to the public health accreditation requirements that we'll see in a few minutes. So I mentioned that you have to do a purpose statement, And you have to describe the planning process already. And you also have to make sure that you have a letter by the Board of Health that says the community health plan was reviewed and adopted by the Board of Health. So those are just a few tips on reminders. And we are going to hear from Rachel at Boone County on how they engage the community in their community health improvement plan. Rachel?
Thank you, Lori. Good afternoon. My name's Rachel. I use she, her pronouns, and I'm from Boone County Health Department. We're located in Northern Illinois, in between Rockford and Chicago. So we're considered metropolitan, but we're very rural in nature. We're an agricultural community here. And I'm going to talk a little bit about community participation in the CHIP, which is an integral part of, a community-driven strategic planning process. So we utilized a few different methods to gather community participation in the CHIP itself. So we presented the IPLAN document for the CHIP to community stakeholder groups throughout Boone County that are currently working on the current health priorities. So our current health priorities are behavioral health, maternal child health, and food security. And we've had multidisciplinary stakeholder groups working on these priorities, and we wanted to present the goals and actions to them to make sure they were SMART goals and we captured the need in the community correctly. So on the next slide, I'll share the kind of questions we posed to them. So the questions that we posed were, does the description or analysis section, so the IPLAN has some, strict guidelines of how you name your sections, right? So the description of the priority, is it accurately captured? And we used a lens framework on our IPLAN to address all of our community needs. So we learned through the prioritization process that the community ranked almost everything as equally important, right? So to address that huge need in the community, instead of just hitting 3 priorities, we're looking at the 3 priorities through 3 lenses. So that would be health equity, access to care, and resiliency. So we can kind of crosswalk all the issues, since all those priority groups, have health equity issues, access to care issues, and we want to have that resiliency or trauma-informed lens on everything as well. So we asked them, does that capture that? And then, of course, we asked if the measurable outcome section or those goals, objectives, if they were attainable, right? They're the priority groups who are going to be working on it. Is this attainable, and do you think this is what the community needs right now? And if we could go back one slide, that'd be great. Thank you. So not only that, but we wanted to get community members' participation as well. So we used multiple methods to try to gather as much feedback as possible. So we had a community forum. Unfortunately, it wasn't very well attended. I think we only had 1 person show up, but we had tables for 1 table for each health priority, and we had an expert from our team on those priorities to explain to that individual and get their feedback. We did have a little bit more participation in Facebook Lives, right? We wanted to meet people where they're at. Maybe they aren't able to get to us because of transportation or they're working, so we want to do Facebook Live. But at the same time, maybe they don't have access to broadband. That's an issue in our community. So maybe the in-person option was better. So making sure that there's multiple ways people can give feedback, right? We also had a Spanish Facebook post. It was just basically a non-live version of a Facebook Live, right? We recorded ourselves talking about the IPLAN in Spanish. Everything was translated, since about 24% of our community is Hispanic and 16+% speak Spanish at home. We also had a press release going out to the public asking for that support, and we had a survey link. In years past, we just had people call or email, but this time we just had a survey link, which was just a comment box. So 1 quick question of provide with your feedback. And not only that, but we really leveraged our MAPP partners, or the Mobilizing Action Through Planning and Partnership, collaborative partnerships, to gather feedback from them and help them push out messaging to the public. So we made a social media toolkit with images that they could use, text in English and Spanish. So all they had to do was upload that image we created and copy and paste the text into social media or their website, or send out to their networks, either through news blast, newsletter, or email to gather that feedback. So that's all I had. Thanks so much for giving me the opportunity to present today.
Thank you so much for sharing all that robust community participation. That's really helpful. When you're in your community health improvement plan and you're really analyzing those priorities and why the priorities were selected, I mentioned this earlier, that you're comparing the priority to healthy people national objectives. You're identifying the risk factors, the direct and indirect contributing factors, which population groups are at highest risk or experiencing greater inequities, and what the objectives are. How are you going to meet those? Or how, what is it you're trying to accomplish? How are you going to accomplish that? What resources are you planning to leverage at the community level to do that? How are you going to monitor it? And how are you going to make the public aware? These are the types of things that you're describing for each priority. I'm gonna skip over this video and have you watch this last video when we send out the final, just because we're a little bit behind. So
I'm going to walk you through
oops,
our
how do
community
I
health
stop it,
improvement.
Samantha? There we go. I gotta end show and pick it right
Oh.
back up. Sorry, from current slide. Here we go. Amy does a really nice job of showing you how they display their objectives. So I really encourage you to watch that video. You'll see that you will have, as we mentioned, you need to have one outcome objective and one impact objective for each priority at a minimum. And this is explaining here and giving you an example that your outcome objective is, both of these are measurable statements, but it's the desired level of change in a health problem or condition. It's a long-term objective. So it's usually, it needs to be, at least for IPLAN, it needs to be at least a 5-year time frame. The impact objective is also measurable, and it indicates the desired level of change in a risk factor. And so while some risk factors are hard to change, we are thinking about these impact objectives as more like intermediate objectives, and that these would be more 2 to 3 year objectives. So you can think about them like that incrementally, that you have your intermediate and your long-term objectives. And then process objectives are really related to your intervention strategy. It's how you're measuring what you're going to do. So if you're offering smoking cessation classes, or you're getting women into prenatal care that need it, and how you're measuring that, what you're doing, how you're measuring what you're doing, whether it's how many classes you offer, or the case management, the outreach, whatever it is you're doing, it's how you measure that. And you can find a lot of great sources to identify your objectives or your outcomes, and we will continue to share sources. If you have a source that you particularly like, where you have identified good interventions, I've heard people say County Health Rankings, Healthy People 2030 has some ideas for strategies. If you have some other places that you like to find good strategies that are resources for good strategies, please include that in the chat and we will share that with everyone. This is just some more guidance on SMART objectives. What I think most of you know about SMART objectives: specific, measurable, achievable, relevant, and time-bound. But SMART-E objectives are also inclusive and equitable. And so it's just ways that you can look at the objectives and make sure that for inclusivity, that they're bringing those traditionally marginalized people and communities into the process activities and decision-making, policy-making in an equitable way, in a meaningful way, sorry. And equitable is seeking to address systemic injustice, inequity, or oppression. And so where you can think about making sure your objectives are addressing inclusivity and equity, that is going to make them even stronger. So that's just one tip there. These pages are just a sample of the community health plan worksheet. That this is not required that you submit this for IPLAN, but these components are required in the community health improvement plan, that you have all of these components and you're describing these for each priority. So you'll see this as a sample form and then a sample of this filled out. And this is again from the IPLAN Basics workbook, and I will leave that here. I'm just going to mention this slide here, the PHAB requirements for a community health improvement plan. Again, they're very similar. The only major difference here is that PHAB requires just 2 or more priorities, whereas IPLAN requires a minimum of 3 priorities. But really everything else is very similar in terms of the requirements. There also, according to the Public Health Accreditation Board, is a requirement that some of your intervention strategies are policies. We know that policy recommendations and policies are longer lasting than some of the other types of intervention strategies, and that's why the Public Health Accreditation Board has that requirement. So that's one thing that's a little more stringent and different, but basically it's the same information that you have to submit. So if you do an IPLAN and you're a health department that is accredited, all you need to do is use that substantial compliance checklist and show the page number where all these pieces are. So we're going to share that when we get to the resource page. If you do your IPLAN in collaboration with the hospitals, and the hospitals have contracted out the data analysis part, there's nothing wrong with that. It's just the way that this is written up and the way that it's put together. You need to be able to show the page numbers and where the required components are in your substantial compliance checklist. And you need to be showing what your health department's going to be doing to implement those priorities for that IPLAN. The third component is the organizational capacity assessment. As Joanne mentioned, you do not have to submit this. You do not submit this to IDPH. You keep it on file in your health department. The regional health officers, when they come for a site visit, they can ask to see it. And there is an old self-assessment tool that was part of Apex PH. It's not, to my knowledge, even available online anymore. But you're really assessing the strengths, weaknesses, opportunities, and threats. You're looking at how you provide the essential public health services. That is a minimum requirement, that you're doing that sort of SWOT analysis and you're doing that assessment to find out your strengths and weaknesses of your organization. Alternatives are if you do a strategic plan that includes a SWOT analysis, that would meet the requirements. Looking at NACCHO's operational definition of a functional health department and completing the tool to assess how well you're doing, or looking at CDC's National Public Health Performance Standards and comparing yourself to those tools. This would be pulling together Board of Health, leaders within your health department, maybe even external folks if you'd like, to have them help assess how well you're doing related to these things. I think most health departments now and organizations do complete a strategic plan, which you could submit, but these other items will suffice as well. Just know that your Board of Health in the letter where they acknowledge that they have approved the Community Health Improvement Plan also needs to acknowledge in that same letter on your letterhead that they've reviewed and approved the organizational capacity assessment as well. These are the steps in the assessment, and I'll just skip over those right now for the sake of time. And I'm going to move us into IPLAN resources and some of the many resources that we have mentioned today, Samantha will tell you how to access those. Samantha, are you on mute?
Hi, so sorry. Computer wasn't working. Thank you. And so with the substantial compliance evaluation, it's used to evaluate structuring our IPLAN around the evaluation will ensure all necessary components are present. The local health departments are required to fill in the jurisdiction and certification period, priorities, and all page numbers. If you go to the next slide. Thank you. So as you can see here, the local health departments are required to fill in the local health jurisdiction, recertification period, priorities, and all page numbers. It includes rubrics on the last 2 pages that outline exactly what IDPH is looking for when assessing compliance, and they can be really helpful to reference before submitting the IPLAN. So as you on this slide, this is focused on the CHNA. The next slide, apologies, are focused on the CHIP using the compliance indicator. And the final piece here is focused on the priorities. So description of the problem, objectives and strategies. And I think is there another one? I'm sorry.
No, but you'll do this 3 times, a minimum of 3 times for each
Yeah,
priority this
for
page.
each priority. That's correct.
Yeah.
And then the next slide.
I just want to mention here that if you know, if you need to make any comments on something, there is a comments section at the end of each page, and that will be helpful if you need to spell something out of why something is on multiple pages, or if it's in an appendix, or anything that you need to explain there, you can use the comment box. But IDPH uses this when you submit your IPLAN to verify that all of the pieces that are required by law are in your IPLAN. And so it's very important that you put page numbers on your document, you have a table of contents for your IPLAN, and that it's very easy for a reviewer to check that. It's the same thing if you were going for public health accreditation or anything else. You'd have to, you know, meet those, have those things very clear and easy to follow. So that's the purpose there. And here you go, Samantha.
Thank you. And finally, some additional resources. So the IPLAN website, which if you use your phone and go and use this QR code, you can also access the IPLAN website there. There you'll find the IPLAN workbook. You'll be able to review questions for substantial compliance, see previous trainings on the IPLAN given by IDPH, and be able to view the current expert consultant list. As a part of our work right now, we're working to update the expert consultant list. So look in the future for new updates to that list. We've also linked the iQuery website, which is currently working with the IDPH to modernize the iQuery website. So be on the lookout for that as well. Some national resources are the CDC's National Public Health Performance Standards. We've also listed out Healthy People 2030, which is an excellent resource for objectives and can be easily adapted for local jurisdictions. Other national resources include NACHO and the MAPP framework. Finally, other resources that are also really helpful are health departments locals who have also completed their IPLAN, reviewing, as we mentioned earlier, and aligning with the SHIP, Healthy Illinois 2028, and using the community guide for proven intervention strategies. And the website is listed there as well. So these slides will be shared with everybody. So you'll be able to access these links as well.
And Samantha, what does this QR code go to?
The QR code, it goes to the IPLAN website. So you can access that through your phone, or you go to the website that's listed above.
Great, great.
And we can
we'll hear from some health departments and how they use their IPLAN.
So at Boone County, we've really tried hard to crosswalk our community health improvement plan, or IPLAN, with all of our workforce plans, including our workforce development plan, our strategic plan, our quality improvement plan, to name a few. So what we've done is integrated our community health improvement priorities into our strategic plan. For our strategic plan, we have 4 goals, and each goal is worked on by a team of our staff from every level of the department. So it's not just managers or leadership, it's people from all levels of the department. And one of our groups is population health, which focuses on equitable implementation of our health priorities. So that's how that's crosswalked. So we're constantly pulling up our community health plan, work plan, all of our objectives and activities, and crosswalking it to our strategic plan, right? Like, have we met our goal for the maternal child health priority, for example? And we're going to crosswalk that with our strategic objectives and goals as well.
So we use the results of the IPLAN and we create a strategic plan. So each of the work groups that align with our priorities have a strategic plan in place. And so annually we meet with each of the work groups and we identify, what the priorities are within their work groups, what projects they're, completing, what barriers are there to reach those goals. Additionally, we're partnering with all our community organizations, so with the hospital systems, with the different health departments here in our county, and we're moving forward. We're trying to implement what we've identified and come up with projects to actually help the health of the community, not just complete a form, complete what's necessary, but to move forward and to accomplish things and work together in a collaborative effort.
We utilize it with our workforce development of our own staff. We make sure that the priorities of the region are the priorities of our health department staff. In our evaluation, we have an area called stretch opportunities. And so if you work in, say, birth to 5, and you really have a big interest in making sure that our families have needs covered, such as emergency food deliveries or those kind of things, you can plug into that work that's our community work through a stretch opportunity, get credit for it on your evaluation, but also increase the number of hands we have to reach out and do priority health work, to work on committees, to show our interest in the community. In our mental health area, we have staff who in those stretch opportunities are sitting on our coalition in Pekin that is around those who are unhomed. And so they're able to interact with some agencies they wouldn't normally do in their job, which is, typically after school programs and epidemiology. So they're able to reach out and work with that. So it's a way for us to get out into the community and provide public health in a very much direct, tangible way.
Once the IPLAN is completed, we share our priorities with our stakeholders, our community partners, our advisory boards, Board of Health, county board members, any elected officials. We use it annually in our report that we put out to the community. And also it's on our website, so it has access for anybody who's interested in looking at the data behind the IPLAN. Mid-cycle, we host an IPLAN meeting update to really revisit our priorities for the last 2.5 years. We do this alongside of our partners. This allows us the opportunity to reveal all of our achievements, as well as listen to our partners in the event that we need to make some strategic changes. This is not a requirement, but we do feel it's valuable because this keeps our document really truly in our forefront, as well as a breathing, living document that we use every day.
So through focus groups and gathering individual perspectives, we move needs to actionable steps and take action based on what the assessment comes out to. But by listening to our community, we are able to better provide services and needs and focus our efforts to make a difference in outcomes.
So once we've conducted the IPLAN, we use it at various levels. One and foremost, we share it. We want to make sure our community partners who are responsible, just like us, in helping create a comprehensive, thriving community, have access to that information for their own needs, for program development, as well as for seeking out funds. Internally, we consider the IPLAN, or the Community Health Improvement Plan, as one of our 3 pillars. We have our strategic plan as a board of health, and that provides that governance kind of lens that we have. We have performance management, which talks about operationally how we are doing better and doing best practices. And then we use the improvement plan as that 3rd one, which is our community voice into the conversation. And so internally, when we are looking at everything from our staff's evaluation and their goal setting, as well as what funding sources we seek out, what partner agencies we support, even when we consider things such as our performance management projects, we look at how it integrates with our improvement plan process, so that we're not something necessarily creating something new, but reinforcing the work and potentially expanding on it. And again, externally, we do share it with our community partners, and our community partners are a big part of it. In Peoria County, we're lucky to partner with Tazewell and Woodford County to do a tri-county community health needs assessment improvement plan. Some of the partners are not only the other local health departments, but our 2 hospital systems, our Federally Qualified Health Center, our United Way, and a multitude of agencies. And so they are at the table from planning and implementation, and when we reevaluate every 3 years. And so for us, we've embedded the external partnerships from day one. And so they also utilize it for their programming as well.
I can't thank them enough for the help, for sharing all of that. So I hope you enjoyed it. We have put an evaluation in the chat. We have captured all of your questions that you've submitted through chat. And if you have more, we'll keep the chat open for a few minutes. You can add those. We are going to answer those questions and send out a response to everyone who attended or registered for frequently asked questions. So I'm sorry that we didn't get to answer those live today. I hope some of them we answered through the communication. You can also see the other webinar topics that we have coming up. And those sessions, we hope, will be much more interactive than we were able to do this one. We just had a lot of information. And as you can see, you have a lot of expertise in all your other health departments who have been doing this for a long time. And we brought some of those folks to you today. And so we hope you'll connect with your peers, and also contact Joanne or Samantha or I if you have questions or need anything else. We can help with providing some technical assistance if needed. Join us on October 10th when we'll have a group session on iQuery and some updates related to iQuery. And join us September 26th, where we'll introduce the new MAPP 2.0 model for you if you're interested in learning about that. Thanks again for your time, and I'm sorry we went over 4 minutes. Thank you for those extra moments. Have a great day.